Thank you, Sahani sir and Dr. Pramila Nairas. Good evening, good afternoon, and good morning. This is the 1657th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. GAURI. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same as usual from yesterday onwards, so that you subscribe the same without paying any money. You can share it with your friends and both homeopathic lovers as well as doctors and students. And a happy Holi to all of the members of IFPH as well as people around the world. And today, let me come to our guest. As you all know, our guest of the day is none other than Dr. GAURI SHANKAR. He has completed his BHMS from Lucknow Homeopathic Medical College and SCPH from Mumbai. He is a SHRF CCRH New Delhi, Government of India, and he's the founder of SHAP, that is Samveda Homeopathic Academic Program in Lucknow. And he has presented various papers at national as well as international sessions. And he has presented some papers in this forum. All those papers were really brilliant. He's a person, he's more involved with the organon of medicine as well as a philosophical point of view. So we are proud to have such a person coming over here and making such a beautiful presentation. And last week, last Monday, Dr. has presented a session here by name Homeopathic Approach to a Case. And today, Doctor will be talking about the second part of the same. So we proudly welcome the guest of the day, Dr. GAURI SHANKAR. It's over to you, Dr. GAURI SHANKAR. Please unmute.
Thank you so much, sir. And thank you so much to all of you. Welcome all of you. And happy Holi from my side. Because today is called the second day of Holi. Most of the places celebrated Holi today itself. So happy Holi to from Samvedna Homeopathic Academic Program. So thank you so much, Dr. Dinesh sir. It's my privilege today give me another session for completing my previous session, Approach to the Case. So thank you so much. And thank you so much, Dr. Mridul Sahani sir, the legendary man in homeopathy. Thank you so much, Dr. Radheshyam sir. There's so many friends. Thank you so much, Dr. Ram Prakash ji, Dr. Lalit sir, Dr. Kalyan sir. आप सब लोगों का बहुत बहुत धन्यवाद. कुछ मित्र हमारे from Pakistan. So thank you so much, Dr. Faruqi, and thank you so much to all of you. Thank you so much. It's my privilege. Today I am going to finish my previous lecture called A Homeopathic Approach to a Case, a practical part, because today I am going to show you some cases. I hope if I remembered, there's some person, Dr. Kalyan or Dr. Ram Prakash sir, you are asking me why I am prescribed lachesis in that cases, right? But I am going to explain each and every part with the context of organ answer, right? How Master Hahnemann says beautifully, from case to case, the approach will be different. Why lachesis? Why not? If there's no any mental sign of prescribing lachesis like loquacity, changing one subject to another subject. There's nothing sign and symptom about classical approach about approach of lachesis. Then why lachesis? Right, sir? So let's start with the previous case. Before going to previous case, let's connect the previous class first, right? After connecting the previous class, we go to the cases. So give me a 1 second. Let's connect previous class first. Then after connecting previous class, we go through the cases. And trust me, guys, this type of cases will blow our minds. How Master Honeyman give a very precise clue, a small clue for a different type of cases. Those are frequently encountered with our clinical practice. So let's go ahead. First, we going to connect the previous lecture. Then after connecting this, we go to the practical application.
Yes.
So,
is everything fine?
Yes, sir.
Yes, everything fine. You can go ahead. You can
Thank you
see
so much.
Nice.
So, this slide is one of the most important slide, and this is simple called SOP of homeopathy. Yeah, SOP of a homeopathic practitioner. So during practice, what should attention, again having thus seen, what attention should in a homeopathic treatment to be paid? As per Master Hahnemann, in aphorism 245, Master Hahnemann clearly says that if you are going to practice medicine, if you're going to practice homeopathic medicine, that what attention should be paid during the homeopathic treatment? Simple. There's a 5-step. This 5-step is called SOP of homeopathy. We should follow each and every step if you want to practice homeopathy rationally, if you want to practice homeopathy homeopathically. Simple. So the first thing is what? The chief variety of the diseases. Number 1. This is the most important part, sir. Hahnemann clearly says in aphorism 3, what is to be cured in diseases? Right, sir? What is to be cured? Then what attention should be paid? The first attention to be chief variety of diseases. Means ki, bhai, jo bhi case hai, whatever case we are going to deal, then which type of case is this? Is this a one-sided diseases? One-sided internal, one-sided external called local malady? What is this? We are going to encounter so-called local malady after acute chronic indisposition. Then after going to describe the case, the variety of diseases, then we are going to understand at what circumstances, the peculiar connectivity of the case. What are the peculiar circumstances? What are the peculiarity of this particular case? That means first we are going to understand the case. For example, if we are going to deal with the typhoid cases, right, sir? Then what are the peculiar circumstances connected with typhoid cases? What are the peculiar circumstances connected with that person who is presented a type of disease? Hope I am connecting, right? ये बहुत 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 important है. First, we are going to understand which variety of disease we are going to deal with, and second step is what are the peculiar circumstances. For example, let's go with some एक छोटा सा एग्जांपल आपको दिखाते हैं. So we are going to understand the step of approach to the case. Simple. What are the steps? What are the steps that should be followed in each and every case? Either we are dealing with acute diseases or chronic diseases. Number 1, if this is a diseased person, this will show the diseased. Then what are the steps? The most important part, the first and foremost step is what? what is to be cured? What is to be cured? Yeah, which type of variety, which diseases? Then first we understand the disease, then peculiar circumstances connected to that person with this diseases, right? For example, suppose that he's suffering from X type of disease, right? Is suffering from X type of disease. Then this is disease. Then this person is suffering from X disease. This is the first step. For example, if you are suffering from acute, then what are the peculiar circumstances connected to these acute diseases? If you are suffering from chronic, or chronic means you're suffering from SORA, psychosis, or syphilitic cases, then what are the peculiar circumstances connected to the psoric case, psychotic case, and syphilitic case? This is the most important part. And we do daily mistakes, sir. I'm going to show you a case. Then first we understand this is a case of typhoid. This is a case of hemorrhage. This is a case of asthma. This is a case of a type of dropsy, a type of convulsion. Simple, epileptic convulsion. Then what are the peculiarity of that convulsion? You should know. Without knowing this, we're not able to cure patient. We're not able to cure homeopathically. And this is the most important part. Peculiar circumstances, and how we make any symptom, any disease peculiar. Simple, with the help of completing the symptom. And how we completing the symptom? With a 5-step: causation, modality, concomitant, sensation. This is the very simple step. और इतना ही आसान होम्योपैथी है. But we unnecessarily make complicated. Just so peculiar circumstances, number one. Then how we make? इसको यही छोड़ के आगे देखिएगा. ये बहुत इंपॉर्टेंट है सर. दिस इज मोस्ट इंपॉर्टेंट पार्ट. फर्स्ट वी नो द डिजीजेस, then we know the peculiar circumstances. For example, first we know the common, then we know the uncommon. What are the common manifestation of convulsion? What are the common manifestation of asthma? What are the common manifestation of PCOD? So Kant, I'm going to show a simple statement of Kant. This slide is prepared by one of my junior. I'm going to show you simple this slide. So how we understand the peculiar circumstances connected to the pathology? Simple. The peculiar circumstances connected to the pathology, उसको हम कैसे समझेंगे? How we understand? So just look at the slide. Just have a look at this slide. Simple. Master Hahnemann says in aphorism 153. Simple. This is a PQRS symptom. And simple. And this PQRS symptom having one uncommon symptom. These are the common symptom. That means first we know which type of variety of diseases. First we know the common symptom of the disease. Then we are able to find the uncommon symptom. So look, Master Kant. देखिए Kant ने क्या कहा? One of the best statement of the Kant. If You are unable to find characteristic symptom. And that characteristic symptom is what? A peculiar circumstances. In an individual, send him to an allopathic practitioner and ask what is that does not fit with the disease symptom. So here Kant is talking about some peculiar circumstances. Kant is talking about uncommon symptom. Right, sir? So let's go to the case. Uncommon symptom. आप my slide दिख रही है? You are able to see my slide? Approach of the case. Anyone? Any confusion? So these are the way of prescribing the remedy. And this is the most important part, guys. This ways is one of the most important part. The approach. And how many approaches? We have so many approaches. In which the one of the most important approach is the ideal drug picture. That means ideal drug picture. This is one of the way. Second is taking a strong striking rubric. Second, interpreting a peculiar behavior and connecting that behavior into a rubric. Combining basic rubric and selecting as per totality. This is the most important part. These are the ways. हम लोग एक ही तरीका. This is not. There's not one way. Only the ideal drug picture way. There's not only the strong rubric way. We have to take a different approach as per our case before us. At what basis, sir? At the basis of status morbi. Status morbi. Yeah. Altered state of disposition. Then combining basic rubric and selecting as per totality. We are doing. We have and remedy group study, and this is one of the most important part. Group study. These are one of the most important approach. Selecting, prescribing remedy or selecting simillimum as on the basis of remedy group study. And the most important part is what? First, we have to go through cause, then manifestation, then disposition. These are the approach. I am going to show a one case on different type of approach. And definitely, if we all are going to observe the case, remedy is in the case. Let's go ahead. So, aphorism 5 is what, sir? This is also, this is the most important aphorism. We should perceive before going to understand a practical approach. Hariman gave wonderful instruction in this aphorism how to deal with the cases and what are the probable cause and what will be the manifestation of that cause or at the level of mind and body. So useful to the physician in assisting him to cure are the particulars of the most probable exciting cause. Then we have to understand what are the most probable exciting cause and that peculiar circumstances are connected with the probable exciting cause. Then we must probe the cause in acute diseases. And what are the most probable exciting cause? These are the field, guys. These are the field. ये वो field है, ये वो areas है, where we are going to probe the most probable exciting cause. If we are going to deal with acute disease, especially, sir, individual acute diseases, right, sir? But if that acute disease is pandemic, sporadic, then we are going to the concept called genus epidemicus. And Master Hahnemann clearly explained that genus epidemicus in the aphorism. Can anyone? In which aphorism Master Hahnemann give concept of genus epidemicus, and what are the concept? Why? What are the concept? What are the condition where we go through the genus epidemicus? And how we select genus epidemicus? So these are the most important part. Aphorism 992102. Dr. Hahnemann clearly mentioned how we get genus epidemicus for a prevailing case for the community. But in case of individual acute disease, we must prove the probable exciting cause. And the probable exciting cause depends upon excess in food. Excess in food or insufficient supply of it. These are the area where we must probe before going to give remedy in any acute diseases. Severe physical impression. Any physical impression, this will be the leading cause. ठीक है. Chill, overeating, dissipation, strain, physical irritation, mental emotion, and like other exciting cause of such as acute febrile affection. Simple. In reality, ये बता चुके थे. So let's guys understand what are the step. आप हम सबको ने step समझना है, and we should note this step. Acute exacerbation of chronic disease. This is one of the most difficult type, where we understand either this is acute or acute manifestation of chronic disease like wars, diabetes, hypertension, con. Then we approach a Cantanian approach. Has to be followed. Cantanian approach. And what will be the Cantanian approach? This simple 8 step. These simple 8 step. ये 8 तरीके, ये 8 step आपको हर केस में अपनाने हैं. Each and every case. First, identify the miasm. Number 1, first step. Or the step is what? Pathology or diseases. As Master Hahnemann mentioned in which aphorism? 245. What? First, we are going to understand the variety of diseases. And these are the steps. The first step is what, sir? Identify the miasm. Miasm means what? Pathology, disease, then manifestation. Then second thing, sir, journey of disease. Because symptom is not disappear just in thin air. Symptom only restore. That means what? Restore the sick. We restore the symptom. Then from more important to less important. If we're not going to make the journey of disease, we're not able to understand either this cure, this case, this remedy is good, or this remedy is going to suppress, cure or palliate. Then you should know the journey of disease. But ये कब होगा? In acute manifestation, that chronic diseases ठीक कर रहे हैं. Then cause, if any, recent, if appropriate or previous, find a rubric of mind and general disposition, general thermal thirst, peculiar physical and general, repertoire and difference the remedy as per disposition. This is one of the most part, disposition. Slow psychotic case है, rheumatoid arthritis है, psoriatic arthritis है, diabetes है, complication of hypertension है, इसके भी यही step होंगे. And the most important part is fast moving fetal illness, out of control. अगर ऐसे cases हैं, then we find out one of the most important rubric and give remedy as per that only. For example, that with the cases, and from cases we are going to understand what are the peculiar circumstances and what will be the approach. Let's go ahead. Again, we are going to understand. We are going to connect. Yes, this suspect rectal cancer patient. And after showing this case, simple, sir. So first we are going to understand the pathology. Then after understanding pathology, peculiar circumstances connected to them. Whenever we are dealing with a case, just put this aphorism 245 into your front desk and go as per aphorism 245. So this will be the simple approach. Sorry, this will be the simple case. This is the case जिसको मैंने पहले आपको दिखाया था. फिर इस पे कुछ सवाल भी उठे थे, तो सवाल का जवाब भी देंगे हम आपको. Just go through the case first. The only information is this is the only information, guys. This is the only information. Information is what? There is a prolapse and bleeding, severe pain. Patient not unable to stand, unable to walk, and patient is in so much pain. They are not able to explain anything except pain, because mentally he is unstable. So this is the only information. Patient is not going to give, not willing to give the case, what family history, drug history, whatever, which are required for giving a complete remedy. The only information is this. Just have a look, guys. For 3 to 5 days, continuous bleeding, as per NS, is so weak, prostrated. This is the only information. So what will be the approach? How we go through the case? Simple. Well, let's go again. This again. I'm going to share you. Let's go. What is this, sir? A physician clearly perceive what is to be cured in diseases. Then again, this one. Chief variety of disease, and second is what, sir? The peculiar circumstances connected with them. Nothing else. Nothing else. This is simple called a one-sided disease. If we classify the diseases, simple one-sided diseases. And what is one-sided diseases? And what are the instructions given by Master Honeyman in aphorisms? How we deal with the one-sided diseases? There's no other information. Only information is what? There's a prolapse and continuous bleeding from that prolapse. Master Honeyman clearly mentioned in aphorism number and footnote number 1. We are not going to give hypothetical explanation regarding the internal essential nature of the vital processes. There is no hypothesis, there is no speculation. We are going to prescribe on current status, that called status morbi. Then simple. So what is this? For example, if this is the case, this will be that case, then what information we have? Simple. If this is the case, this is the case, then first is what? First is prolapse. Then prolapse is where? Anal prolapse and bleeding. इससे ज्यादा कुछ नहीं. Anal prolapse and bleeding. So let's go to the rubric. Simple. The rubric is what? If we go to the repertory chart, या अगर हम repertory पे जाएं, so there is 2 remedy only. This is the simple. Rubric is what? This will be the rubric, guys. Hemorrhoids, protruding, prolapse, bleeding with. And finally, when we are deciding remedy as per disposition of the patient, then here, what is the physical disposition? Is bleeding continuously. Then we prescribe a remedy having bleeding disposition, having hemorrhagic disposition. Then in these 2 remedy, which remedy having hemorrhagic disposition? Simple, as we know, lachesis. Then we prescribe lachesis. Then after prescribing lachesis, look, this will be the condition of the patient. इतना तेज तो सर्जरी भी काम नहीं करेगा सर. So here question arises, sir. There's why lachesis? Is there any locicity? Is there a changing disposition? Is there any sensitivity around cloth? Is patient not loquacious? Then why prescribe lachesis? Master Hahnemann clearly explaining how we treat a one-sided diseases in aphorism number 163. So let's go ahead. Let's go with another case. Then we are going from the approach, going from the question answer. You can ask the question. I will give answer. Before going to this, let's understand one more case. Give me a minute. There is one case. अभी आज ही का केस दिखाते हैं. A case from today only. As I am recording the case, this case from today only. A medicine for rectal cancer. Yes, sir. Lachesis, sir. Lachesis. Why lachesis? Because there is a one rubric called rectal prolapse. Yeah, hemorrhoid prolapse, bleeding with, and prescribed lachesis. Potency 200, 1 dose. अब ये भी कैसे हुआ? Why I am prescribing 200? Why giving 1 dose? There is so many confusion. Let's understand part by part. This is going to understand one more case. This is called simple a violent convulsion. And remedy is in the symptom, guys. Every remedy, every pathology comes with their remedy. Every disease come to homeopath with their remedy, and remedy are कहते हैं ना कि remedy is connected to his manifestation of the symptom. Let's go ahead. और आप सब बता लोगे, बहुत आसान है, हम लोग बस को कॉम्प्लिकेटेड बना देते हैं. देखिए, day 1, there is the case. Day 1. बहुत ध्यान से listen and watch careful to the case. This is also a type of one-sided diseases. Here patient is not in this condition that he see explaining each and every peculiarity, each and every minuteness. He is not in the sense that he is going to explaining you what happened to her. He is not going to give a symptom as per totality, as per location, sensation, concomitant modality. Patient is unconscious. Patient having continuous convulsion. Then what attention should be paid? This is the case of convulsion. Confirm that what attention should be paid in this convulsion. Just have a look. They are asking that there is a 5 times in a single day. 5 times. And this is the violent convulsion. So what attention should be paid? And what will be the observation? Attentively observing physician. Simple. Let's probe this case. Is a case of violent convulsion. So aphorism 245, a case of violent convulsion, number 1. Then second, what attention should be paid in this peculiar, in this a case of convulsion? So simple. बताइए. Can anyone? This is a case of convulsion. Confirm? Then what attention should be paid? If we clearly understand that type of violent convulsion, itself is a violent convulsion, then face distorted during convulsion. There's one thing, moaning during convulsion. And which type of convulsion? Ophostotonus. There's a back. Ophostotonus convulsion. If you're combining these 3 or 4 type of peculiarity, then the simple remedy is, can anyone? Simple remedy is cicuta verosa, 200. Here we prescribe 1 ml, 3 doses. After prescribing the cicuta verosa, कोई कहेगा कि सिकुटा वेरोसा कन्वर्जन की है, ये तो काम करे, बिल्कुल करनी चाहिए काम. Why not cicuta verosa? So after prescribing cicuta verosa, क्या नाम मत हुआ, घर कहाँ, क्या दिक्कत कर लिया, तो जब से दवाई पीले बाड़ू तब से आया फर्क तब से कोई दिक्कत ना बैठा कुछ खाए पियो so these two cases are going to be explained with the help of Master Hahnemann's organal aphorism. Yeah, these are the only simple one-sided diseases. Then what will be the approach? How we prove the case as per Master Hahnemann aphorism? Only observing the case, finding peculiar circumstances connected with them, and give remedy as per the disposition of the patient. Are remedy acting too fast? Only if we are going to the correct approach given by Master Hahnemann. There's so many approach in which one approach is approach of one-sided diseases. If you are going to understand one more recent case, देखिए बहुत सिंपल, मैं हिंदी में आपको कहता हूं, हर पेशेंट अपनी दवाई साथ लेके आता है, बहुत ध्यान से, बहुत attentively we have to observe the case. There's nothing called rocket science in homeopathy. There's nothing called any pre-decided concept. The only concept is we have to attentively observing the patient and give remedy as per the manifestation of the patient. With a concept, with the help, with the quality called unprejudiced observer. So let's go. Let's understand. Let's look a small case. Then after we're going to take your cases. I'm not able to. My voice is clear or not? I'm audible to all of you.
Yes, there is no problem with your voice because the other person may having some network problem. That's why.
Okay, sir. So, sir, I'm going to show one more case. Then you can all ask your query. I'm happy to give answer. Right, sir? This one small case. This is the recent case. I hope I am giving remedy.
Doctor, only 15 minutes. So
Okay.
if you have
Don't worry,
cases,
sir.
because some people may have questions and answers, then we can have another session in the first week of April.
Don't worry, sir. Please ask question, ask some query. I'm happy to give answer as per my knowledge, sir.
Because this kind of presentation really motivate everyone to study in that way also. Congratulations for your excellent session. Even though we dedicated this session for question answer, but unfortunately there is no time for that. That's why we have to dedicate 15 or 40 minutes for that. And definitely
sir.
you can present some more cases in April first week itself, so that the people will be in a better way to understand how you select these remedies and why these why you
So
are.
can I give answer to previous session question, sir? Why
Yes,
not
yes,
some
yes,
any
definitely.
remedy?
Definitely, Kalyan Swarup, sir. You can ask once again the question because there are some few newcomers here. So if you ask the question, then Dr. Gauri Shankar will give the answer. Yes, sir. Please unmute you, Kalyan Swarup, sir.
Kalyan sir, please.
Hello,
Yes.
sir.
Hello, sir. Namaste,
Namaskar.
sir.
No any question from my side, sir.
Thank you so much, sir. Thank you so much.
Actually, Dr. Gauri Shankar is clearly saying you follow the organ and you adopt the organ, and when you can cure the patient, especially chronic disease, you can cure. If you not follow the organ and not follow the principle, you cannot cure a chronic case. This is the matter of Dr. Gauri Shankar ji.
Thank you, sir. Let me show, sir, one thing. that are, I hope this is most important for everyone. Why why not we are giving remedy as per the totality, as per the classical presentation of the cases, right, sir? So
But
let
in
me
the
show
first case,
one small
yes,
aphorism.
yes, doctor. In the first case, you told that it is because of the hemorrhagic tendency you give this lac-assist to the patient. But there are so many remedies in medicines are there in this hemorrhagic medicines having
Then why lachesis, sir? Then
then
why lachesis, right, sir?
that was
So
the
I'm going
question.
to explain, sir, why lachesis. Because in homeopathy, we are adopting a concept of convergent way, not divergent way, right, sir? So we take symptom from the patient and give remedy as per their totality. Wonderful, sir. So let's go ahead to understand why not any other remedy. So if we are going to understand this, and this is the most common symptom, and this is the most common question that arises, why not any other hemorrhagic remedy? Why lachesis only? So guys, let's understand this question with Master's Hahnemann aphorism number 6. Let's go ahead and understand that aphorism 6. What aphorism 6 says? So, aphorism 6 is called simple or unprejudiced observer, in which Master Hahnemann says कि we have to compare and take a symptom, take a complete symptom, confirmatory symptom with the patient. Just give me a minute. I'm going to open my organon PDF. So and one more PDF, 160. 3. And one more PDF, 189. Yes, sir. Let's go ahead. So first, we are going to understand what is to be cured in diseases. और क्या वो जो हम ठीक कर रहे हैं वो उस दवाई में है? Simple. Let's go ahead, sir. This will be the one of the most perfect answer. Look, doctors. Master Hahnemann clearly explained in aphorism 162. Sir is saying that sometime happen. Sometime happen. कभी कभी ऐसा होगा. क्या sir? Owing to the moderate number of medicine at known with respect to their pure action, जितनी दवाइयां हमको पता है उन दवाइयों के एक्शन में से, ठीक है ना, कि owing to the moderate number of medicine at known with respect to their pure action, that but a portion of symptoms, sir, a portion of symptom under the treatment are met with the list of the symptom of the most appropriate remedy. Dr. Dinesh is saying ki why not any other remedy? Why lachesis? Why? Because we are prescribing at what basis, sir? We are prescribing at the basis of disposition and at the symptom, at the present predominant symptom. Then symptom is the protruding hemorrhage with protruding rectum, protruding hemorrhoids with the bleeding. In whole repertory, there is 2 remedy only. Then why prescribing? Then our attention should be paid on that portion, that 2 remedy only. But the portion of the symptom of the disease under treatment are met with the list of the symptom of the most appropriate remedy. This is the answer, sir. And consequently, Master Hahnemann clearly accept this is not a perfect remedy, but we should give that only imperfect remedy. Why? Because there is no speculation in the homeopathy. प्रेजेंट प्रीडोमिनेंट कैरेक्टरिस्टिक जो मिलेगा उस पे देना है, बाकी का स्पेकुलेशन का कोई रोल नहीं है सर होम्योपैथी में. देयर इज नो रोल ऑफ स्पेकुलेशन. Consequently, this imperfect morphic agent must be employed for the lack of more perfect one. This is the simple answer by Master Hahnemann. Must be employed, sir, must be employed, lachesis, for the lack of more perfect one. Because there is the only symptom that indicate lachesis and leptanium. Similarly, Master Hahnemann similarly give perfect answer in aphorism number 6. This is the answer, sir, from Master Hahnemann's side. This is not answer from my side. It's
Yes.
answer by Master only. Master
Yes,
give
yes.
perfect explanation each and every case, sir.
It's a great.
We are not able, willing to understand the organ. That's why we have so many questions, sir. Master Hahnemann clearly says, sir.
Yes, sir,
I'm
it's
going to-
it's really a very good answer, and not only that, the patient is, as we know that the bleeding from piles or hemorrhoid is very venous blood also. So in those venous affections, lachesis is a number one remedy.
Yes, sir. So
That's
this is some simple, sir. Master Hahnemann giving a simple answer, sir, in aphorism 6. It's a wonderful answer, sir. Wonderful answer. Sir, this is the answer. Yeah, this one. So, what we understand, sir, the unprejudiced observer take note of nothing in every individual case except the change in the body and of the mind, which can be perceived externally by the means of senses. And he noticed only the deviation, not a speculation, only the deviation for the former healthy state to now disease individual. Abhi usme kya problem dikh raha hai? And which are felt by 3 steps, sir. First, felt by the patient himself. These are the 3 criteria. Before giving the remedy, we have to confirm that one symptom on which we are going to prescribe the remedy, the one thing which are felt by the patient himself, remarked by those around him, and observed by the physician himself. Then we give the remedy. Then we are able to make a portrait of this. So in each and this, in the case of this violent convulsion, simple. The current status, the status morbi is what, sir? A violent convulsion. If I'm reporterize this case, violent convulsion, cicuta, distorted face. देखिए ना, मैं दिखाता हूँ rubric मैं आपको चल के दिखाता हूँ. Simple. We are going. Let's go through the repertory. Then we are able to understand what is the case. Simple. If we are going to understand with repertory, then पहले तो simple. Let's understand with the help of repertory. This is the repertory. Simple. Convulsion offers the tonus. Simple. पीछे जा रहे थे. I'm going to take this rubric. Mind, morning, convulsion during, convulsion in, face, distorted, distortion of face, convulsion during, look, sir, simple. One remedy is called cicuta verosa. And let's go and perceive the case again. If you allow, sir, then I'm going to show again the case Then you observe all these symptoms in this one case.
Yes, sir.
Convulsion of osteotonus, convulsion morning, face distorted, each and everything is connected with this case. And then the easy approach, sir. There's no nothing, sir. मैं आप लोगों से simple हिंदी में इतना कहूंगा, sir. Homeopathy is the easiest science. Please don't make homeopathy complicated.
Yes, exactly, exactly.
It
This
is
is
simple.
yes, definitely. This is what some people are doing. Going in this simple way, definitely we can win the case. That's what the presentation is all about. And if anyone want to speak, or you can raise your hand for or just 2 minutes remaining. If anybody has a question or anybody want to talk to Dr. Gauri Shankar, you may raise your hand so that we will allow you to unmute yourself.
Please ask any question.
Yes,
Because
only
if
two.
we-
The problem is only
because
2 minutes.
I'm going to give answer as per organ. There's nothing from my side. Each and everything is from Master Hanuman side. You can ask.
Yes.
And homeopathy is so easy, sir. Mere sir, I'm going to give a small quotation in Hindi. My sir says कि मरीज इतना आसान है होम्योपैथी, मरीज से पूछो जैसे, दवाई दो वैसे, और
Yes.
बीच में बनाओ पैसे.
Yes,
इतना
doctor.
आसान है.
Yes, doctor. Which potency you go to the patient?
Yes, sir.
Which patient? Which potency you go to the patient?
Sir, potency is a very confusing concept, sir. My sir clearly says, Gauri, please be aware, please go, please, मतलब कहना कि आप दो तीन चीज का जो मतलब आई एम सो सॉरी सर, आई एम नॉट एक्सप्लेनिंग इन इंग्लिश. दो या तीन चीजें होम्योपैथी में बड़ा डिफिकल्ट होता है. पहला, अ कॉन्सेप्ट ऑफ वाइटल फोर्स इज सो कंफ्यूजिंग, so please don't debate on this. The concept of potency, Master Handman clearly says in aphorism, it's not a matter of experiment, it's a matter of experience. You can experience with your own cases time to time. And the second one is a repetition. It's also a matter of experience. But one thing I'm going to give answer with Master Hanuman teaching. Master says he give remedy with the speed of the pathology, with the speed of the patient. If your patient having high speed, then go with the high potency. With your patient having moderate speed, then go with the 200. And with the
Yes.
structural changes, if you're going to treat the structural changes like PCOD, warts, callocytes, your any tumor in bone, if there's so many pus, so many pathology, then go through the 38 potency.
Exactly, exactly. That's what the homeopath has to follow, and homeopaths need to go.
Yes, aphorism. Ajit giving answer to me. Let's go to understand, sir. If you allow me, I'm going to show one aphorism which Master Hanuman clearly explaining. Please
Yes,
don't go away.
yes, we can.
All
Yes,
this-
no, sir. Time is sort of another session is about to begin, and we can have the next presentation with the first week itself, April, so that we can have such a beautiful discussion. Also, after your presentation about whatever the cases you are about to present. Anyway, I invite Dr. Rambaresa sir to say vote of thanks to the session. Yes, sir. Please unmute.
Thank you, Dr. Dhanesh ji, and Namaskar, Dr. Kalyan Swarup ji, and congratulations, हमारे भाई डॉक्टर शंकर गौरी जी. Very nice case. There are two case presentation, very good, describe disposition mind to body. So very thanks. According to Organon philosophy is a very good select remedy. According to Organon philosophy, homeopathic is the easily easily just select remedy. Gently, rapidly, homeopathy is the gently, rapidly, and permanently cure. So very thanks, Dr. Gauri Shankar ji.
Thank you so much, sir. Thank you.
Namaskar. Thank you. Good night. Again presentation, behalf of IFPH. Again presentation. Thank you, excellent session. Thank you.
Thank you,
Thank you, sir.
Ram Professor Sir, Dr. Kalyan Swarup, and Dr. Shankar Gauri, that is Dr. Gauri Shankar, and Dr. Ganga Agar Singh, and all others who attended the session in this evening. And tomorrow we will have a session from Dr. Manid Drupat, and that he's coming for the first time, and he will be talking about homeopathic strategies in headache and migraine. Hope all of you will be with us tomorrow at the same time, and you can use the same link that we shared for the session today. Thank you once again, Dr. Gauri Shankar and all of
Thank you
this.
so much,
Thank
sir.
you. Thank you.
Thank you so
Wow.
much to
Good
all of you. Bye-bye. Thank you.
Good night to all. And it is
Good
up
night.
to Dr. P. Shaira to moderate the Malayalam session.